Hi everyone, I'm Dr. Kayla Ross-Bitticks. I'm one of the associate veterinarians here with Loomis, Basin Equine Medical Group, and I also work out of Amador Equine based in Sutter Creek. Today we are going to be talking about how to place a ball bandage or how to bandage your horse's foot. There are a couple things that I wanted to talk about first. We're going to show you a picture here on the screen of a completed ball bandage, just so you know what we're talking about and sort of the context of what we're going to be doing today. So this picture is a beautiful ball bandage. It's how everyone should look at the end. And basically what we're going to be doing is covering your horse's top of the pastern down to the bottom of the foot. So I think it's important that we go over some anatomy and some reasons why we are even going to be using these bandages in the first place. So this is a basic picture of a left front foot of a horse, and so we're going to start at the bottom of the picture and work our way up. So when you pick your horse's foot up, there's going to be some structures that you see obviously on the bottom of their foot. The majority of that is going to be the sole. That is the nice flat part of the foot, and then you'll see a very prominent frog in the center of the foot. And if we work towards the outside, you're going to talk about the hoof wall, which is nice and shiny and clean in this picture. And that's basically the hard outer capsule of your foot. And then at the back, you're going to notice that there'll be two heel bulbs, one on the inside and one on the outside of the foot. And then you'll have your coronary band, which is your junction between your hoof capsule and the skin of your horse. And then you move up to the pastern, and then you move up to the fetlock. So I think it's important, having seen the picture of the completed ball bandage and now having seen some anatomy, you can sort of start to understand what structures we're going to be covering, protecting, and keeping clean with this bandage in place. So given that we've talked about some anatomic structures in terms of what we're trying to cover and protect, we can now talk about some of the reasons why we actually use these ball bandages or these foot bandages in the field. I think the most common reason we end up applying these bandages to your horse's foot is to treat what's called a hoof abscess. So these are little pockets of infection that can drain out the bottom of your horse's foot, whether it be the sole or some structure related to the frog. They can also drain out the heel bulb. They can also drain up out of the coronary band. Whatever the case may be, we're going to be putting a ball bandage on your horse's foot to either promote drainage of that abscess or keep it nice and covered and clean and sealed off from the environment as it fills in and heals. Another common reason that we end up placing these bandages on your horse's foot is to treat any sort of wound or laceration to any areas of the skin that you saw covered underneath that bandage. So probably the most common one we're talking about is called a heel bulb laceration, and it's literally exactly what it sounds like. So it's a nice slice through either one of the heel bulbs, both of them, and this bandage does a really great job of coming up over that wound, keeping it nice and clean and covered until sutures are ready to come out or until it heals on its own. Another common reason we end up placing this bandage is to treat something called a street nail. So that's basically slang term for something that penetrates up through the bottom of your horse's foot. It could literally be a nail. It could be any other metal object, a piece of wood. So basically foreign material that we end up usually removing from the bottom of your horse's foot, which leaves some sort of hole or draining tract that, again, we want to be able to keep that nice and clean and protected from the environment as it continues to heal. Sort of the last category of things we talk about treating with these bandages are definitely some more complicated cases that normally require some sort of surgery on your horse's foot. So that could be anything from treating white line disease and needing to do a hoof wall resection, to treating things like keratomas or canker, or treating some sort of coffin bone infection where we actually have to go in and debride that coffin bone. This bandage will do a really good job of keeping those surgery sites nice and clean and protected. So many of you at home may be wondering, why place a foot bandage when a lot of these things I can treat at home using some sort of reusable boot? And there are a lot of advantages to this foot bandage that I think make it a better choice in a lot of cases compared to a boot. So you have some instances where you're going to want a boot and want something reusable, and you're definitely going to have some instances where you're going to want to be using a foot bandage. And I think that's sort of where your veterinarian's opinion comes in. We come out and we can evaluate your horse and tell you what's going to be most appropriate and get you going with this foot bandage if that's what we want to end up using. So I think one of the biggest advantages for you guys in terms of this foot bandage is that so long as you apply it correctly, this is a bandage that can be left in place on your horse's foot for 3 to 5 days at a time. So usually you can set it and forget it, as I like to tell you guys in the field. So again, placing it appropriately, and you don't have to touch it again for a while. Whereas with a reusable boot, you're still going to have to take that boot on and off of your horse's foot every day to dump all of the shavings and the dirt and everything out and make sure that that inner bandage is staying nice and clean. Not necessarily the case with your foot bandage. It also creates a really nice seal at the top of the bandage with the material that we're going to be using. So a lot of times your reusable boots, you're still getting shavings and dirt and everything that comes in from the top, and you can't necessarily seal it off to the rest of the environment. This bandage that we're going to show you how to place today does a really good job of keeping that from happening based on the layers that we use and how we apply it. The other thing that I really like about these foot bandages is that it's truly a bandage that conforms to your horse's foot. So as long as you apply it appropriately, it molds to their foot, they can walk on it pretty comfortably, and they're going to wear it down how they want to. And because of that, you're going to prevent things like pressure sores and areas of irritation that sometimes can happen with boots, especially if the boot doesn't fit them appropriately. So one of the most common places you're going to see this at is the heel bulbs, or sort of the back of the leg and the back of the pastern. And again, because of the materials that we're using and how we're putting on this ball bandage today, those are likely to be non-issues when you're using the bandage over the boot. So some special considerations I wanted to touch on before we go about placing this ball bandage. Again, I think it's super important that you always call and talk to us if you have any questions about whether this is the right thing to do and whether we should come see your horse first to determine that a foot bandage is necessary. I think it's really important to remember that because everything that we're enclosing from the bottom of the foot up, we need to really try and clean everything that is going in that bandage. So if your horse's hoof is covered in mud and the heel bulbs are all dirty, or your pastern and fetlock are kind of caked with a bunch of different things, you're going to want to brush that off, hose it off, and basically try to clean everything up before you go about bandaging the foot, because again, this is going to be everything sort of contained in almost a makeshift boot, if you will. The other thing I think we need to consider is, just like any other bandage, usually if your horse needs a bandage on their foot, that means that they need to be confined to some sort of smaller area. So whether that's a little paddock or a stall if you have one. And it's also great and ideal if we can keep these bandages nice and dry. They are pretty impermeable to most of the elements, but water is definitely not one of them. So again, keeping them in a nice dry spot so that the bandage holds up like it should. And the last thing with this bandage is you're going to want to pick up that horse's foot and you're going to want to look at the bottom of the bandage every single day and make sure they're not wearing through all the layers. The whole point of placing this bandage is to seal that foot off from the environment. And so if we have the horse walking on it and they're starting to wear holes, or they're starting to look thin on the bottom, then you're probably going to have to add more duct tape or bandaging material to prevent that from happening. So before we get to the actual application of the bandage, let's just briefly review some of our layers. So many of you may have already watched the video that was the first video of this series, which related to how to bandage your horse's lower leg. We're going to be talking about basically all of those same layers, but talking about how to apply them specifically to the foot. So you've seen many of these before, but again, I just want to refresh your memory. So depending on what you're treating, if you're treating a wound wound basically on the lower part of your horse's leg or more related to the foot, you're going to be placing an inner bandage first. So the first thing you're going to use is what's called a telfa, or a non-adherent pad. So again, this is the first thing that's going to go against the wound itself, and then you're going to secure it in place with basically stretchy white gauze known as cling gauze. So you can see that this has a little bit of give to it, and so that's what's going to secure your telfa in place. Following that, you're going to use some elasticon. So this is basically a really sticky kind of elastic tape that is safe to put directly against the skin, whereas some of our other layers are not. So just remember that. This is okay to go against the skin as long as you don't apply it too tight. If we're treating something more like a hoof abscess, or we're concerned about putting a substance on the bottom of your horse's foot and keeping it in place, a good old-fashioned baby diaper will do. So this is, I believe, a size 3. And if you have a pony or a miniature horse, obviously this diaper is going to be pretty large on their foot. And if you have a draft horse, it's not going to be big enough. So I would say for the average sized horse, this size diaper is going to do just fine. So once you've placed kind of your inner bandage, you're going to move on to sort of the outer portion of the bandage. So the first layer is again going to be this sheet cotton that has been rolled already. Again, you want it to be at least 4 layers thick, so that way we don't have anything too thin and we're not worried about the next layers putting any pressure where they shouldn't. After the sheet cotton, you're going to apply this brown gauze. This is a substance that really doesn't have a lot of give to it, so it adds a lot of stiffness and rigidity to the bandage, which is actually great for the bottom of the foot when you're talking about a horse needing to kind of walk around on this. So it makes the bandage nice and stable. The next layer is going to be vet wrap, which comes in kind of this plastic already. So that's kind of the colored stretchy material that I'm sure many of you have at home. This is something that needs to be applied with padding underneath it, so not directly against the skin. So just keep that in mind when using this. And then the next thing we're going to be using is what we call a duct tape square. So I already have one pre-made here. And so basically this is a 12 by 12 duct tape square that I made myself, and then you essentially just put it in a pattern so that you can cut down the corners, and you'll find out why that's so important when we actually go to apply the bandage. And then the last thing that you're going to be using again is some elasticon, and this is what's going to seal the top of the bandage in place to prevent anything from getting down into the bandage. So now that we've sort of talked about all the reasons why we want to use the bandage, let's show you how to put it on a horse. All right, everyone, so now we have Zan here. He's going to be our model today. And you'll notice a couple things that when we kind of zoom out for you guys, I think it's really important that when we go to bandage your horse's foot, again, remember to clean everything sort of on the lower part of that leg. The majority of the time, your horse is going to be barefoot when we place this bandage. So Zan does not actually have a wound down there today. So we're going to be placing a bandage over his shoes. So just keep that in mind, that a lot of times we're going to want to take those shoes and or pads off so that we can remove that source of contamination inside the bandage. The other thing that I've done is, because not all of us have perfectly level concrete slabs or barns at home, is you can use something just like a clean towel that you have laying around your house as sort of your surface to keep the foot that you've already cleaned off, and so we're not contaminating the bandage as we're continuing to place it. So I'm going to show you how to place both the inner bandage, assuming he has a wound down there associated with his foot, as well as how to put the diaper in place. So we're going to start with our telfa like we described. I'm going to open this and I'm going to grab it at the corner. You don't want to touch the center where your actual wound is going to be placed. And then you can kind of get this started so that way it's already kind of unraveled a little bit and kind of set on your cling. And so if we're assuming that the wound is here kind of at the front of his foot, you're just going to place that and you're going to kind of use your thumb and forefinger to hold everything in place, and you're just going to nicely wrap your cling around. You'll notice that while I'm doing this, I am making sure that the cling falls under his heel bulbs, because that is going to be the anchor point for this entire bandage that we're placing today. So again, you're just kind of unspooling this. I'm not putting any tension on it. I'm not making it super tight. And I'm just going basically until the end of that bandage material. which is honestly longer than you would think sometimes. So when you get to the end, you're basically just going to pull out your previous wrap that you unspooled there, and you're just going to kind of tuck it in so that way it holds itself in place. The next thing we're going to apply is the elasticon. This again is safe to go right against your horse's skin. And so basically what I do is I start in one place and I kind of hold that in place, and I sort of unwrap and I unravel the elasticon and then just sort of lay it down. And again, I sort of go stretch underneath his heel bulbs because that's his anchor point here for the bandage. And again, I'm just going to basically pull it out and lay it down. I'm not putting, again, a ton of tension. It's basically nice, even tension as you're putting the elasticon on. And I'm just going to go until I'm satisfied and until my cling is covered. And then I use a pair of scissors to cut off the end and basically just stick it to itself because that's how it's going to hold best. If we're talking about wanting to secure something to the bottom of his foot, so assuming we're treating him for a hoof abscess and we need to use some sort of paste or an Epsom salt bandage or one of the animal Intex pads that we use, we basically use one of these baby diapers. So you want to make sure that you open this diaper up completely, that you have it ready to use, and this is going to basically fold up the front and the back of his foot. So you're going to pick up his foot, good boy, and you're basically going to place the diaper like so, and then you're going to use the tabs of the diaper as your fastener, and you want to fasten these pretty tight so that way you've got your diaper in place and it comes up over your heel bulbs like so. This is a spot where as long as you've got a nice clean surface, you can give them a break if you need to grab your other bandage supplies. I'm going to take my gloves off for this next part because it is much easier to apply the bandages without the gloves on. And you want to make sure you have everything unwrapped and ready to use. So this is basically the start of the ball bandage. So again, you're going to pick up your horse's foot, and he's essentially going to be non-weight bearing this whole time. And so I'm going to use my knee as sort of my anchor point for him to hold his foot up in place to be able to apply the rest of the bandage. So the first layer that we're going to place is this sheet cotton roll. And basically you want to use kind of as your marker the bottom of their fetlock, and then the rest of it is going to hang off of their foot. So again, you're just going to kind of put this in place to the bottom of his fetlock, and you're going to hold it together with one hand, and you're going to kind of unspool with the other and just straighten this out so that it falls off the rest of his foot. That's what we want, is all of this extra material down here. Then you're going to take your brown gauze, kind of get that started, and I kind of tuck it in under that flap. And I'm going to start at his heel bulbs, and I'm going to use the heel bulbs as my anchor. This is what's going to keep your bandage from slipping off your horse's foot. So you want to tighten as you come across the heel bulbs, and you can kind of you'll start to see a contour in the bandage. So I'll go 3 to 4 times around and then basically stop. And then you're going to take the rest of this material kind of in your opposite hand, bunch it together and fold it back up. Hence the reason we call it a ball bandage, because it literally looks like a ball on the bottom of his foot. And then when you're bandaging, I basically take the approach of a crisscross pattern. So you're going to go from the outside heel bulb up and across the inside toe, and then you're going to go from the inside heel bulb down across the outside part of his toe, and you're just going to keep alternating this until your roll is all nice and finished. And again, you can kind of just leave this here, let that hang, and I'm going to grab my vet wrap. And we're going to do basically the same thing that we just did with the brown gauze. Again, you want to make sure that you get all of these layers up over their heel bulbs, but you'll notice how I still have white padding and white cotton sticking up out of the top of the bandage, so that way these materials are not directly touching his skin. And so I'm just applying the vet wrap so that I don't see any more signs of my brown gauze. And just again going until the end. It kind of sticks to itself. We're going to put his foot down for a second to give him a break. And so now that we've given him a little bit of a break, we're going to take the duct tape square that I talked about before. Again, about a 12 by 12 is going to be sufficient for the average size horse. And you basically want to cut down at your 4 corners so that it makes it easier to apply. You're going to pick up the bottom of his foot. Again, I'm going to set it here kind of on my knee. And basically, you want the center of your X that you made to go essentially in the middle of the bottom of his foot. And I fold in the front and the back first. And kind of try to prevent all of your wings of your square from sticking together. And then I fold in the sides. And I'll put his foot down here so you guys can see what it looks like. So basically what you have is sort of a makeshift boot with all of the duct tape that you've applied. And you can still see the layers of the bandage underneath, and you can still see that I have a very adequate amount of padding above all of these layers so that they're not directly contacting his skin and going to cause any pressure sores. So once you've got kind of the square kind of up and over the bottom, you do need to put additional duct tape around the outside to keep everything, you've put everything up the sides and now you want to put it around to keep it in place. So I grab a duct tape roll and I kind of get it started, and then I again pick up his foot. This one's going to get a little bit loud. So again, I was making kind of an X pattern with the duct tape. So going from opposite heel to toe to again try to reinforce anchoring that bandage on the heel bulb. And then once I've done that sufficiently and I put his foot back on the ground, I basically just continue to finish this so that I get, again, the same kind of contour with these bandage materials so that way it'll stay in place for 3 to 5 days at a time. Kind of smush all your duct tape down. Again, he is going to walk on this bandage and he's going to wear the bandage how he's most comfortable. And then the last layer that we're going to put is again your elasticon. So just like we showed you in the previous bandaging video, you're going to start at the front of the leg and you're going to bandage towards the back. So you're basically stretching it out, laying it down, stretching it out, laying it down. And you want to do this so basically you get a nice seal up here over the top, no more white showing. And then once you're finished, just make sure you kind of stick it to itself. And there's your beautifully completed ball bandage. All right, everyone, so I hope you've learned how to apply a ball bandage. Hope you've enjoyed the video. Thanks so much for tuning in. Zan says thank you as well. Just keep in mind, this may have looked really easy for me, but I've also had a lot of practice. So if you have any questions or concerns, you want us to show you how to do it, or you're just wondering if it's even needed, please don't hesitate to give us a call. We'd love to help you out. Good boy.